Welcome to another episode of Victoria's Lounge from the Crown Plaza Hotel. Today we're talking about a pain so excruciating that many women are forced to lay aside their daily activities just to manage it. Some call it endo pain, and it's as a result of a condition called endometriosis. At least 1 in 10 women are experiencing the heavy pain that comes with this silent condition. But I have some endo-warriors who are ready to share their journeys and experiences and hopefully offer some inspiration and encouragement to some women out there who are going through that same pain. And incidentally, it happens to be Endometriosis Awareness Month. So let's meet the endo-warriors now and get the conversation started. Dr. Wanyoike Gishuhi is a senior lecturer in the Department of Obstetric and Gynecology at the University of Nairobi. He is also in charge of the infertility and gynecological endoscopic training programs at the Kenyatta National Hospital and University of Nairobi. Arti Shah is an image consultant, beauty therapist, and media practitioner with 17 years of experience. But closest to her heart is what causes her the most pain from as early as she can remember. See how Arti is coping with endometriosis by making healthy diet choices. We know her as Fire Mama. Njambi Koikai is a local reggae pioneer, funny and witty comedian we all know and love on radio and our TV screens. But even with all her success, the media personality has been battling endometriosis that almost cost her her career. Irene Mumo is the CEO and founder of True Ways Enterprises Limited, a honey agri-processing enterprise. Irene, who is a wife and mother, was diagnosed with endometriosis after childbirth to achieve their purpose in life, regardless of their circumstances. Doris Murimi is a management consultant and runs a program on endometriosis awareness called Endo Sisters East Africa. She has battled with endometriosis for 28 years and was only diagnosed 3 years ago. Remember, hashtag Victoria's Lounge is how you can chime into the conversation as usual, and this is certainly a discussion that you don't want to miss out on, and spread the word on. Now, the reason I'm wearing yellow today, and actually most of my guests are, is because this is Endometriosis Awareness Month. And more specifically, this week, we're really trying to raise awareness on this condition that a lot of people go through. 1 in 10 women actually experience this condition, and some have no idea what they are going through. So let me start with you, Dr. Wanyoike. For the people who are watching now, probably heard of it, probably not, but what is endometriosis?
Endometriosis is a disease which will affect mainly the pelvic organs. What it entails is there is implantation of the endometrium, that is the lining of the womb, outside the uterus. And when that happens, that will cause a lot of inflammation and a lot of pain. Most of the time, manifestation will be severe, painful periods, to the extent that a young girl will not be able to go to school, or some will not be able to go to work. And sometimes also present with pain throughout, pelvic pain throughout, and sometimes progressively people may have difficulty in conception. And those married couples may have painful sex. That's the clinical presentation. Okay. So sometimes they may just get confused with painful periods.
Right. And some people totally disregard it as just that and not think that they need to go to the doctor to find out what more could be happening to their bodies.
Precisely. So it's very critically important that if you have painful periods to the extent that it's affecting your lifestyle, you're not able to work, you wake up at night, you're not able, a young girl is not able to go to school, then you need to see a gynecologist for the diagnosis to rule out endometriosis. Or even chronic pelvic pain, persistent pain in the abdomen, you need to rule out endometriosis.
So what are the causes, before I get to my other guests, what are the causes of endometriosis?
Endometriosis is a disease of theories. We don't know for sure what causes it. It's many theories what causes it. For sure we don't know. One of the most plausible theory has been what we call Samson theory. Is the lining, instead of the periods coming out through the birth canal, they flow backwards into the pelvic cavity, into the abdomen. And the lining gets implanted in the structures there, in the ovary, in the intestines, and continues growing.
Wow.
And since you can't bleed outside, that will cause very severe pains. But again, that is not conclusive, because we know most women have retrograde. The menses go backwards, but they don't get endometriosis. The body knows how to control about it.
Right.
So that is the key theory about endometriosis. It is also thought that you could be born up with, it could be genetic, could be some slightly ratio because of genetic issues. So those are the most plausible theories, but we don't know for sure what causes endometriosis.
Wow. And which makes it extremely difficult. I know for you, RT, you have been a champion in raising awareness on this. But take us through when you first started experiencing symptoms and then finding out what it was exactly.
My story basically started, I think, I must have had painful periods, but I have literally blocked off my teenage years as well. In 2001, I had my appendicitis surgery, which obviously was because of my appendicitis, but I also used to suffer a lot of low blood pressure, low iron levels. I was very, very anemic. Used to have very faint dizzy spells, feel very weak. And then in 2006, I went for an emergency surgery because I had a cyst in my ovaries, which is the size of a cricket ball.
Wow.
And that pain was extremely excruciating. Like, I didn't know what was coming or going. And through laparoscopy, obviously, is where I was diagnosed with endometriosis.
Right.
I cannot tell you how long I had it for prior to that, but I was diagnosed with in 2006, and ever since been managing it. And it's just recently where I've actually changed my diet to manage the situation, because obviously unfortunately in Kenya, there are not many doctors who specialize in this condition per se, or who are aware of it. Where there are very, very few who are knowledgeable about this condition.
And I can imagine how difficult that's making it in terms of diagnosing and trying to figure out how many women are being affected. For you, Doris, I was reading through your story, and over 20 years of dealing with this, but you had no idea.
Yes, I had no idea. It's actually 28 years. I've suffered with the condition for about 28 years. I think from being a teenager, just maybe a year into, after I had started menstruating, I started having a lot of pain with my period. My mom took me to like 4 different gynecologists, and they all said that, oh, well, it's just one of those things, and maybe when she has her first baby, the problem will end, So that's my first recollection. But over those years, the issue was really a lot of pain, and particularly around the ovulation time and during the period time. That's a lot of chronic pain and painful periods. But what I noted is that endometriosis is progressive, because 5 years ago is when all hell now broke loose. Is when now I started severe bleeding, and all the horrible symptoms, the IBS, all the symptoms that are associated with this condition now really manifested. And then it was then just 3 years ago that I then had to have my surgery, where there was a big chocolate cyst in my ovary, or what they call an endometrioma, and that's a real sign that somebody has endometriosis. And so I did the laparoscopic surgery, and they found it was there, and my doctor was able to see even from the inside just how far you're able to identify what stage I could possibly be in. And he realized that I was very advanced, stage 4, because I had had it for so many years. So that's actually what happened. And then I recently had my second surgery as well. Because it came back, and I had fibroids as well. So
why do you think it took that long? Was it misdiagnosis, or maybe you just didn't go to the doctor in time to be able to find out what it could be?
I think I did go to the doctor early. In my teenage years, actually. I did go to the doctor. It's just that the information was not there about endometriosis. At that time, when I went to see the doctor, they ruled out 2 things. 1, does she have fibroids? 2, could it be cervical cancer or anything? Once those tests were ruled out, and everything, because you can't see endometriosis unless through surgery. Then I think the doctors just thought there was nothing wrong with me, and they just said some girls get it harder, get painful periods compared to others.
And that's the thing we don't realize, is only through surgery is how you can diagnose it. So a lot of women will not know until they go through that, and I don't want to mispronounce, laparoscopy.
Yes.
Oh, wonderful, on the first try. But for you, Njambi, you are fire mama, you know?
Literally.
Literally. And we weren't thinking that someone like you
Yeah.
would be going through this. Of course, we saw your public battle with, and we didn't know what it was exactly,
Yeah.
with endometriosis. But just take us through your journey and how you first found out.
First of all, I've always suffered painful periods from the onset of my menstruation. When I started menstruating at 13 years, when I was 13 years old, and I remember I was on a bus going to school. I was in Form 1, and I've never felt heat like that in my life. It was like I was between Mombasa and Mandera at the same time, you know. So much heat, you know. And I remember I threw up on this passenger that was on the bus, and I felt so sick. So I got off the bus, those days of Kenya bus. I was ambassador. I crossed over, took the next bus home, and I went home and I told my mom, I feel sick. This is terrible, you know.
Yeah.
So she tried to figure out what was going on, but she just couldn't. So I went to the bathroom and came back, and I came out screaming, and I was like, I'm bleeding. And she said, no, you know, now you're a woman, you know, you've started menstruating, and that's when the journey began.
Wow.
I went through so much pain, but because my mother went through the same pain and my grandmother went through the same pain, they always told me it was normal.
It's normal, yeah.
And that, you know, when it happens, you can take painkillers. So when it gets worse, you know, just woman up. It's normal, and you know the usual. Once you get your first child, it's gonna go. But I'd like to say that a baby is not a pill.
Yeah.
Yeah. So for all those women out there who've always been told that, you know, once you get a baby, the pains go away. For some women, the pains don't go away.
Yeah.
And for some women who do not have endometriosis,
Right.
could actually get it after they get the babies.
Wow.
Like she said, it's a progressive condition. It got worse 2-3 years ago. I mean, I've lived with it all my life, and part of my negotiation, especially when I'm going to look for a job, is always how many days do I get off
Okay.
a month. It's never about my salary, first of all. It's about how many days can I get off, because I need 7 days in a month.
Each month, yeah.
Yes,
yeah.
to be at home and just to stay at home with my pain,
Wow.
in my mood swings, in my heat strokes,
Right.
you know, in all that madness.
Yeah,
And of course, sometimes even being rushed to emergency units in hospital.
My goodness.
So 3 years ago, the pain started getting worse. You know, started getting worse. I got anemic. The bleeding became worse. Then I started coughing, and I always thought these endless coughs were not ending. So I thought it was the studios. So every time I'd get into the radio studio, I'd switch off the AC. But it never stopped, persisted. So 2 years ago, when my grandmother was diagnosed with cancer, we went to the hospital, went to the same hospital, and I remember we saw the same doctor, and I did an X-ray, and the doctor was like, you need to be admitted right away because your lungs have collapsed, and I don't even know what you're doing here right now.
Wow.
So I'd been in that condition for about a month, with collapsed lungs for about a month, and I didn't know. You know, we did the first surgery. And when we did the first surgery, they were treating the lung collapse.
Wow.
But they didn't know that it was endometriosis that was causing
It
the lung
literally
collapse.
spread to your lungs.
Yes.
Wow.
Yes. So what happened is, first of all, it punctured my diaphragm and went straight into the lungs. So what happens is, every time I'm menstruating, these endometrium lesions are bleeding into my lungs.
Oh my.
So then, after that, I went home. I recuperated. A month later, I was back in hospital, and this became a back and forth for about 3 months, and I got 5 surgeries.
Wow.
Yeah.
Oh my goodness. And I know we'll get into how you literally manage this. And a lot of you say it's the pain that is the biggest factor in all of this.
It's debilitating pain.
Yeah.
It's excruciating. It's maddening. It's sickening.
You can imagine the mental toll, because the fear
Yeah.
that takes over when you think this pain is coming
Yeah.
and I can't escape it.
Yeah.
I mean, Irene, take us through your journey.
Mine, I'm married. I have one son who is 17 years, and this is the reason why I'm going to agree with her, because even having a child doesn't stop the endometriosis problem. And like they have said, this way starts way back in high school when you start menstruating. But for me to get to understand what the main problem was, is that I became severely anemic, extremely anemic. And for a moment I thought I couldn't produce my red blood cells. You know, it was really until I even got iron, IV, into the veins. It's painful.
Oh my goodness.
And I remember one day in 2006, my son is 6 years old. So I've gone through all this. My son is 6. And I fell, or rather I got out of a bus and I saw stars. So at Posta, there you are, you've jumped out of a bus and you see stars. So you're trying to figure out, you know, are you going to fall or not? So what I decided, straight to Aga Khan. I even stopped whatever it is I wanted to do.
Right.
Picked a cab, went to Aga Khan Hospital. And the doctor there, we went through all this because I've gone through IV injections for iron, I've gone through all these things, but it's still not helping.
Right.
So my doctor is the general practitioner asked me, okay, do you have a problem with your periods or something like that? He said, they're very heavy. Actually, they're so heavy, it's like I'm being cut off. A part of my inside is coming out like flesh, meat.
Wow.
To cut a long story short is that the doctor told me, why don't you go and see your gyna? Probably there's something there that you need to actually test. And for sure, when I went to see him, we went through the test. His aunt now was giving me the IV iron just to pump up the iron levels and everything. And in 2008 now, I went through the laparoscopic surgery. I remember looking at the video and I'm feeling like when you wake up, you feel like your intestines are falling all over.
Oh my gosh.
And you have this big bloated feeling in your tummy like there's so much air. And I can see him trying to sizzle, trying to figure out. He told me it was so bad, my left ovary had already collapsed. And 2008, went through the laparoscopic surgery, eased out a little.
Okay.
But of course, like they say, it can start recurring again. But so far, so good. I've managed the pain, but it was really, really bad.
My goodness. And to hear you women talk about, I'm managing the pain, you viewers have no idea, and you'll get to see what it is they have to do to get through this and to manage this condition. Let's take a short break here on Victoria's Lounge. We'll be right back. Welcome back. You're watching Victoria's Lounge. Now, before we talk to the Endo-warriors and find out how they manage this condition, Dr. Ari, let me get this from you in terms of risks. Are there women who are more at risk than others?
Yes, those who may be more at risk, especially in the young girls, so who have slightly more weight. Obesity may be slightly be predisposed towards getting endometriosis because they tend to produce more estrogens. So you find that they're slightly higher. So you may find that those who are affluent may be slightly at risk just because of the weight factor. Two, there's the issue of childbirth. Let's go back to the African issue. When I was in medical school, that's about almost 30 years ago, we were told endometriosis does not exist among the Africans. And that was the teaching all over the world. So you find there's a few papers, and the doctors still up today believe endometriosis does not exist among the Africans. It was partly true because long ago, we said one of the theories about endometriosis is retrograde menstruation. So long ago in the Africans had the children early when they're in their teens. When you get children, you don't get menstruation, so you don't get retrograde menstruation. When you're breastfeeding, you don't get retrograde menstruation. And when you have 8, 10 children, at any one time, you're not having menstruation. So the likelihood of you getting endometriosis is less. So that was the reason. Therefore, those who have very, very few children or delayed in getting children, they're slightly predisposed towards getting endometriosis. So there's a risk factor in that. Again, as we have said, this is a disease which will affect about 10% of the population. We can't tell everybody in the population get your children early. So it's early diagnosis is very important. Again, for reasons which are not clear, it's been found that there's more predisposition in more affluent. Maybe it's partly the diagnosis is easier. As I've said, the lifestyle is a bit different. So affluents tend to predispose towards that. Again, for those who get sexually transmitted disease, they tend to get protected because the tubes get blocked and they're less likely to get endometriosis. Again, that is just a scientific finding. So there are all those factors again. Again, depends on the affluence again. You're more likely to get diagnosis, you're more likely to get laparoscopy when you're affluent because you can go to the hospital, you're likely to see a doctor.
And then, of course, because it can grow in different areas of the body apart from just the uterus, the womb, or the ovaries. Where are the other areas? We heard in Jambi's case, it can go all the way up to the lungs. The lungs, yeah, that's absolutely true. Because what you said is there's retrograde menstruation. One of the theories is the disease can spread through the lymphatics or can be able to spread through the blood. So if you're able to spread through the blood, it's been found actually even in the brain. It's very rare,
very rare in the lungs, but it's been found in the umbilical cord, even in the skin, so it can spread in here, but that's less likely because of the blood spread.
Wow, amazing.
Yeah.
And of course, in your case, Arti, you said it spread to your larger intestines by now. Just to describe the pain factor of this for someone who has no clue, because you're thinking, okay, these are women talking about pain during menstrual, it happens, but just break it down.
On a scale from 0 to 10 for a normal person, the pain threshold, ours would, I'd say, obviously, okay, everyone's is different, but majority of us would be at probably a high pain day would be 400.
Wow.
Right? Okay?
Wow.
That could be
1,000. Jambi saying 1,000.
Actually 1,000. Basically, this is how I describe pain so that you can try understand it. Okay? Imagine your entire area where the endometriosis is, okay, where you're suffering from, wrapped in a barbed wire, and then you vacuum suction it through.
Wow.
Or you're juicing it through a juicer.
My goodness.
That is the pain that you feel. And that is just a mild version of it. Because together with the pain, there are many other symptoms that come with it as well.
Right.
You know, you have dizziness. Like for me, when you do pain management through medication, you have side effects. I got side effects like I suffer from migraines. I'm asthmatic. So I have my asthma flares, my pumps have to be with me. I have to have my anti-nausea with me all the time. I do carry my pain medication. I get fluid retention. So my hands and my feet swell up to a level where I cannot hold anything or walk sometimes. And then you have insomnia. So obviously lack of sleep doesn't help your body to rest, so you cannot recuperate.
Right. My goodness. So even the medication dealing with the pain can exacerbate other conditions within the body, which is crazy. And for you, Doris, you're saying the medication that you found, which has been a lifesaver, is not exactly the full solution.
Yes, it's not. And maybe just before I talk about the medication that I use, in terms of the pain that I felt on my side, was to the point where I started passing out. I would faint because of the pain. Yes, fainting spells. Because first of all, you're very anemic. You've had your menses going on to 28 days, 30 days continuously, non-stop. So of course, anemia is a critical cause. You're sick. You're in a permanent state of period-like symptoms, and they are really bad, chronic pain and all that. So what happened is my body, to react to kind of protect me, would just shut down. So I would pass out, and sometimes, and then I'd had to go into hospital to get the intravenous injection to help manage with the pain. This is at its worst. So that was really the worst part of it, and I really literally thought I was going to die. But talking about the medication that I found, there's a trial drug that was that was set up, that was introduced into the market, called Visan. And many women have reacted differently because it's a hormonal drug, so people react differently to it. I think I'm one of the fortunate ones, because for me, Visan turned my life around. But this is after having done the surgeries, of course, and all that. But taking it stopped the bleeding, it minimized all those symptoms, the chronic fatigue where all that. I had a normal day. I could wake up and do a 9 to 5.
All right, Njambi, for you, because you talked about settling on terms when it comes to a workplace because of the pain, but you're in the public eye. We see you on TV, hear you on radio. So for you, when it comes to that time where you have a very public job and you have to keep face, how do you handle that?
I'd never do it. First of all, let me say this disease sort of slowed down my career. It also crashed my dreams. I've lost out on very many opportunities because of this job. I was doing my 3rd degree. I didn't really perform well in my exams because I was basically out of school most of the time. And I couldn't concentrate, and I basically wouldn't be able to perform according to my merit. And I really feel bad because I'm a very hardworking person. I love what I do, and I love to realize my potential. But then I realized that, at the end of the day, this thing is here with me. I have to live with it. And there's purpose. There's absolutely, there's a major reason as to why it occurred to me in this very tragic way. And I realized then that's my voice. So me being in the public eye has also helped in a way to raise more awareness about it. But I have bad days, Vicky. I'm not going to lie to you. I have terrible days when, like for example, when I used to do news and, you know, my period just starts before I go on set and I'm just like, I can't do it and I won't do it. I can't move. I start throwing up, you know. So, and thankfully some of my bosses understood, some didn't. Some thought it was just, you know, it was just a period and why am I overreacting, you know. And it's one of the other things that we also deal with as women, and this transcends from high school to our workplaces where you're told you're just you unajifanya tu, you know. It's, and every other woman is going through periods. Why is yours so serious?
So different.
You know, why are you fainting? You don't want to go to class or you don't want to work. But it's serious, and we really have to keep raising awareness about this.
For you, Irene, because you're a mom already, and you were hit by the condition, you talked about it a bit, but how has this affected family life for you?
For me, I think the worst case scenario is that nobody understands what you go through. Even your partner doesn't understand. And you're sitting in the middle of the night on the bed, feeling pain, lacking sleep. You have to take a walk around the house. Like my colleagues are saying, it's not, you can't explain it.
Right.
And the fact that it's associated with a regular, supposedly natural occurrence, it's like it will pass. But today, tomorrow, the day after, then a day out, 2 days, then it comes back again, and you're thinking, there's something not right here. So with time, it's not like my husband ever understood really what was going on, but I just told him, I'm not just feeling well. And the association of migraines, insomnia, fatigue. I'm a full-time consultant, but I remember one day I'm sitting in somebody's office and I'm doing this assignment, and you know, everything just went haywire. So I called my husband and told him, you know, I can't move, and I think there's something very wrong somewhere, and we need to get to MP-SHA. Just those 3 words. So when we got there, I'm telling the doctor, this whole part down, there's something wrong. I can't feel myself because of the pain. And the fact that the clots, you know, it's not even menses as such. You're talking about clots, big things. And when I told the doctor that, he just told me, no, we need to give you something that stops, like she says, that bleeding. Because it's really bad, because you lose focus. It's your blood, it's your blood.
It's coming out of you.
It's coming out of you, so you lose focus. So the whole setup of, you know, people trying to understand. I tried to ask a few people, do you ever go through this? And like she says, people don't know.
They have no clue.
You've been assuming it's just something that you've gone through all throughout. But I said, no, it's like this. Oh, you mean that's what it's called? Yeah, sometimes not. So until we sat with Doris one day, you see, even you've been going through this. You know, it was very interesting. When we met, and I was like, I've had it for so long, so, you know, I was happy because I'd known her from before.
And I can only imagine the comfort you get out of finding sisters and support in all of this. And we'll talk about some of the initiatives that have come up out of endometriosis. You women are not alone, at least for those who are watching thinking, I'm going through this pain by myself. You're not. When we come to part 3 of the show, you'll see what they're doing to raise more awareness. We'll be right back. Welcome back. You're watching Victoria's Lounge. We're talking about endometriosis today. Now, you're probably wondering, what is this on the table? This is actually a creation of Arti, and she's going to take us through what it's all about. But before we get to you, Arti, Dr. if you can take us through some of the treatment options. We've heard about painkillers, some hormonal treatments, and what that does. Also, the concern is, how much does it cost?
The most important thing to understand about endometriosis, it's a chronic illness. And that's what the doctors themselves, the physicians, the client don't seem to understand. There's no magic bullet. The studies which have been done in Europe, it costs more to treat endometriosis than treating diabetes mellitus. We know diabetes mellitus is a huge disease affecting both men and women and children, but it's going to cost more to treat endometriosis. You look at it in terms of people are not able to go to work, they're not able to go to school, they have to go to the hospitals, they need surgery, they need medication throughout. That's how huge the problem. So you find the budget for treating endometriosis in the developed world is huge. So it's very, very expensive to treat endometriosis. The other biggest handicap we have in our setup, you need laparoscopy. That is the gold standard for making the diagnosis of laparoscopy. There's no laboratory test you can do. There's no radiological X-ray ultrasound you can do.
Yeah.
You must be able to get into the abdomen, laparoscopy, look inside, and take a biopsy and confirm this endometriosis. And that's why it's become very difficult in our setups, because among the public hospitals, the only hospitals I'm aware who can do laparoscopy is Kenyatta National Hospital, Mombasa, Eldoret, I think Kisumu. The rest cannot be able to do. So diagnosis becomes a big problem, getting it up.
Yeah.
So you need to see your gynecologist every 3 or 6 months, and keep on following up to see whether there's any problem, do ultrasound, and try and intervene before it gets worse.
That's a great point, considering that you have to have a very close relationship with your physician. Very close. Okay, and Arti, now take us through this concoction.
I've changed my diet.
Yeah.
You have to manage it. Like, what happens with diet is, so Dr. Kyama, who's a scientist doing research on this condition as well, he explained to me how the whole diet side of it works. It's basically dairy, gluten, wheat, soy, whatever you put into your body causes a chemical reaction that enhances the production of estrogen. Estrogen is what feeds endometriosis. So this basically is what I call my power endo smoothie, which I do a lot of research. This is what I found that actually I created 3 days ago, and has literally subsided my pain tremendously. From a 400, it's brought my pain to about 100.
Wow.
And basically what this is, it's all plant-based, like almond milk, cinnamon, strawberries, and star anise, which is licorice or fennel, depending on what you can, and substitute it for, and there's ginger. So all these elements are basically, they're very good in controlling endometriosis. And more about my ingredients, you can find it on my page. On my Insta page, I lobby a lot about diet changes and on endometriosis.
And we'll have all the links on our social media pages, so at least our viewers can go and check more recipes and see what you're doing there. But Doris, you've been championing this quite a bit, Endo Sisters East Africa.
Yes.
Tell us more about your organization.
Yeah, Endo Sisters East Africa is a program of Gospel Preachers Church, and what we do is our objective really is to create awareness of course, on endometriosis, and also to give women hope, women living with endometriosis hope. So we really focus on 4 main things. One, we have the first Facebook page, which is our information portal. So we give out a lot of information, and actually, as the Endo month is going on, we've been doing a whole campaign, on endometriosis, talking about the different myths. So we've have like 18 different myths. It's called Endo, Art for Endo. And then the other thing that we do is, the issue of research and adolescents particularly is we have outreach programs. We go to schools and speak to adolescent girls about, about endometriosis. And what we've done, and I think this one is an important point because it feeds into the research, is we are collaborating with Endometriosis Foundation of America. They have their Empower project where they provide endo kits for edu kits for schools. So they've given us access to those edu kits, and we then go out, talk to the girls using those edu kits, and then send back the information with pictures and everything to the US, and they've actually been cataloging that information. So when they report that in America, these are the schools that they have managed to have talks, and the girls they've done talks with and talked up to about endometriosis, they also say that in Kenya we are also making this much progress. This has been done, so we are at least able to contribute to that kind of research. And then the other thing is just supporting women, older women who are suffering from the disease, issues of counseling, group counseling and all that, providing even a forum where we can go and talk to their families and let them know what the sickness is all about, and also an avenue, because many want to give back to society, also an avenue to come and work with us when we go out to do the outreaches in schools.
And Jambi, I just want you to kind of give a word of encouragement to a woman watching, has no idea what to do, probably going through excruciating pain, but seeing someone like you manage it. What would you say to her?
I mean, they're not alone. There's the whole cliche of what doesn't kill you makes you stronger, which is very true. I've suffered endo, it made my lungs collapse 5 times, and I've gone 5 surgeries, and also gave me heart disease. That's something else that I didn't share. I've been on Xanax for a very long time.
Yeah.
I avoid stress as much as possible.
Yeah. Yeah.
But if we can manage, if we can manage the pain, we can manage the madness that we go through. I believe there's something about women that carves out strength, courage, determination, and I believe anybody out there who's going through this madness, just know that you're not alone, and we can do it. I've been raising awareness on my platforms as well, and I'm mainly focusing on the girls in the slums and in the ghettos, because man, there's no information in the hood,
Yeah.
Totally.
Also, support is so crucial,
Yeah.
and ignorant opinions should be kept to themselves because it's very painful. Start learning, and then talk about it.
Great advice. Yeah, and that's the thing. You can't afford to keep silent in your pain. And this is another thing too. Artie raised a great point of support. Not just the women who are going through the pain are the ones who should be vocal. Thank you so much to the Endo-warriors and to Daktari and the wonderful initiative that you're taking to go further in studying this and understanding it here in the region and in Africa as well. We need more physicians like you, I must say. Thank you so much. And that does it for Victoria's Lounge. Thanks for watching. We'll have more information on our social media platforms, Facebook, Instagram, Twitter, about where you can access help and get more information on endometriosis. You don't have to suffer alone. There's several women who are going through the same, and you can get strength out of their experiences and their journeys. Thanks for watching, and thank you to the Crown Plaza Hotel for hosting us. Let's do this again next week. Have a wonderful evening. And it happens to be Endometriosis Awareness Month here in March. And we're talking to Endo-warriors, sorry. Get through. Let's meet it now. Let's meet them now. Can champion, yeah.
Can champion because that's how I wanted to do the